Hi, everyone. I'm Mo, Azam anesthesiologist here in Orlando, Florida, and I was lucky enough to have Congresswoman Stephanie Murphy join us on a Zoom chat today. Hi,
Great,
Congresswoman.
great to see you, Mo.
So I heard healthcare might be on the ballot this year.
I think healthcare is absolutely on the ballot this year. I think not only are we living in the midst of a pandemic, but this crisis has shown us areas where we could do better as it relates to fortifying our healthcare system. So definitely on the ballot this year.
Yeah, well, I appreciate your willingness and openness to be, an ally and a resource for all of us in the healthcare community. I remember, I think we reached out back in the middle of March, and were very concerned about PPE at the time. I think we had a conversation around the strategic national stockpile.
Yeah, I worked on pandemics when I was at the Department of Defense. Back then, we were dealing with the avian flu. And so when I started to hear about what was happening in China, I wrote a letter in January to the state leaders and, asking them to focus on this, and then held a roundtable in February with infectious disease experts, emergency management folks, because I think here in Florida, we're particularly vulnerable. We have a more mature population, and we were a tourist destination. And so those two things made us particularly vulnerable. And we did that roundtable before the first case even came to Florida. And then, when we had our case in March, and I really started to reach out to our medical community. We did telephone town hall with folks who worked in healthcare, and then talked to your group and others, really trying to address the issue around PPE and making sure that we coordinated our response to this pandemic. But it's been a challenge for everyone.
Yeah, I'm fortunate to be part of a large group, and some of our colleagues and partners across Florida, from Jacksonville to Fort Myers, but we also have some partners all the way out in Seattle, and they landed some of the very first cases. And very quickly, their systems got overwhelmed. They didn't have PPE. They were reusing masks for weeks, and their ICUs were full. They built a field hospital, and they started putting folks in there. So we quickly got that information, and we also got their protocols around ICU care in the operating room. That's kind of what we do. We're the intensivists of the operating room. And so we were very fortunate. I remember we did talk about PPE requirements, the national stockpile, and other resources. And we were really fortunate in Central Florida that we were able to keep up. Unfortunately, we did have to shut down a lot of procedures, elective procedures, and our operating rooms, our ambulatory surgery centers. But we pivoted that, and I think that was another conversation we had at the time to say how we could use our ventilators as additional resource from the operating room for ICU patients.
Yeah, I've been really proud of the healthcare system in Central Florida for handling, this crisis so well, and being able to be innovative about capacity and, ensuring that the community continues to get care. I think as we've learned more about this virus, the healthcare systems in Central Florida have been great about integrating those learnings and learning from other systems across the country.
So then I think after that, we survived that first wave, and really did an amazing job with very, very few healthcare workers here getting infected. Around the rest of the country, that wasn't quite the case, and we know that in Detroit and New York and other places, the overwhelming patients and the critical care needs and the lack of PPE. I mean, I think overall it was over 4,000 healthcare workers died from COVID in the crisis. But I guess the next issue was that, well, it was an economic impact. Of course, everyone feeling that, but in healthcare as well. So the same folks that were on the front lines were also now getting very short hours over the summer, and furloughs and laid off. And I think you were involved in a task force on economic recovery as well.
Yeah, what was interesting was, what I was proud of was to be identified by the president as somebody who could work across the aisle just to get things done. And so I was tapped to be a part of the bipartisan White House task force on reopening the economy. And in addition to being a part of that task force, watching the economic impact on Central Florida was a big part of the reason why I worked so hard to get on those 4 big packages of relief that we passed into law at the beginning of this crisis. We were able to ensure that there were resources for healthcare providers to have PPE, and also to ensure that businesses had a little bit of a lifeline to help help them through the economic impacts of all of this. Obviously, there's more that needs to be done, but in those initial packages, I'm proud to say that they included my employee retention tax credit, which helped to keep workers tethered to their jobs and to their health insurance, which was critically important in this pandemic. And I have been working over the last few months trying to push for a bipartisan deal for an additional COVID relief package. I've been disappointed that we haven't been able to get that across the finish line. But I think I've been pushing on both parties, leaders of both parties, to move faster. There are people in our community who continue to need support, and we need to continue to put resources into addressing the healthcare crisis. That's really the only way we get out of this economic crisis.
Right. There was a lot of medical practices that stayed solvent because of those efforts. And fortunately, my practice was able to keep on everybody. We didn't furlough anyone. And those economic bailouts or rescues have really kept folks going, which have kept our operating rooms up, which have kept our surgery centers up, which have kept hospitals staffed. And I know, and again, in a lot of parts of the country, that's not quite the case. Healthcare workers, because of the lack of bread and butter work, have essentially been moving out or leaving. So that's been very helpful. We look forward to seeing what happens now by the end of the year. I think a lot of practices and a lot of nurses, a lot of physicians that are tied to those practices are going to be getting towards the end of the prior relief. What do you think about obviously, there's a national recession related to COVID, but there's certainly a healthcare recession, and then I think you said it very, very well. As folks lose their jobs, they lose their health insurance. As they lose their health insurance, they then have less resources to deal with this pandemic.
Yeah, this is critically, that's why it's so important that we get additional relief out there. Our healthcare systems, we have to make sure that they're strengthened and bolstered in the midst of this pandemic. One, because they provide much needed care for those who are afflicted with COVID-19, but they also provide care for people who have all kinds of other medical conditions. And none of those things stop just because a pandemic hits, right? All of those things are still there. And so I'm hopeful we'll be able to get a relief package out there and make the necessary changes to make access to healthcare affordable and enable people to take care of their personal health in the midst of this pandemic.
I appreciate all your efforts. And you're on the Ways and Means Committee, right? And so that is very much tied to the economic legislation.
Yeah, the Ways and Means Committee has jurisdiction, a pretty broad jurisdiction over a lot of things, whether it's taxes, trade, healthcare. And so we're really trying to look at ways in which we can increase people's access to coverage. I have a bill out there with the former HHS secretary, who's now a colleague of mine, Representative Shalala, to make health insurance for young people more affordable. As you can imagine, they are they're graduating. Many of them are graduating into an economic recession, and we want to make sure that they have access to healthcare during this time.
Yeah, Congressman Donna Shalala and yourself have been really great allies for the physicians as well. Because in all of this, apparently there were some efforts to tie some legislation around surprise medical billing to some of the COVID relief stuff. It's definitely an obscure issue that most folks may not be on their radar. But basically, there's a lot of narrow insurance products out there. I know my parents, my father just wanted to go see a physician, and they were not in his network. And so when people do go to see those physicians or nurse practitioners, maybe through the emergency room or elsewhere, and they find out they're not in network, they get a surprise bill from the insurance company on that. And the physicians' practices, a lot of family care practices have a significant would have a significant impact if they weren't included in these networks.
Yeah, I mean, a lot of people, when you talk about surprise billing, there certainly are some folks who are bad actors, but really sometimes the surprise really is that you didn't have that great of insurance. And that's the surprise, right? And so we're working to address that. But one of the things that's really important in our efforts to lower healthcare costs and ensure people have access to quality, affordable healthcare, we want to make sure that we're not making kind of systematic, massive changes in the midst of a pandemic when healthcare systems are already so stressed. Do no harm so that we can get through this pandemic. And healthcare is so critical to us being able to get through. The healthcare system is so critical to us getting through this pandemic that I think we have to be really thoughtful about our approaches.
I appreciate that very much. Thanks for your partnership. Thanks for being able to be willing to listen to us and be so easy to get in touch with, and being our ally in DC for Central Florida and for the healthcare community.
Well, thanks so much, Mo, and thank you for what you and your fellow practitioners do on the front lines of this pandemic and this healthcare crisis. And I know we'll all get through this together. And, it's really important that people just follow basic medicine and science, and we'll be able to beat this virus in that way. So thanks so much for all that you're doing.
Thanks.
Take care.